Hi, Dr. Steve. If I use your vacuum cleaner and stuck it up my nose, would I be able to breathe better?
Auto Test. All right. Yeah, you? Thanks for coming. You gonna stay for dinner?
No.
Okay. That was good. Yeah, I took a fatigue reprieve today instead of modafinil. Yeah.
Yeah, they
Joga.
are not
Slash
real.
jeans. Okay.
Joga.
Honey, no.
'Cause if you ever come here, if we ever invite you and you come, don't feel like you have to dress up because that is not the case. Because I will not be. I just had to go to the dentist today, so I wore these pants. Fit me from 3 years ago.
Oh, I can't fit in clothes I had 3 years ago. Well, good for you.
Of course,
Let's
it
see,
was
let me get your-
Manjaro and I can't afford it now. but
microphone.
Anyway,
Hmm?
it was Manjaro,
Mm.
and now I can't get it.
Kilimanjaro.
Yeah,
You
Kilimanjaro.
Kilimanjaro Safari?
I've
That's
heard
my
of that.
favorite ride.
Same.
We did the behind the scenes thing once. That was neat.
Same. I've also done the nighttime one.
Oh,
where
no,
you
that's
wear
cool.
vision goggles.
There you go. Oh, shit. No, we have not done that.
You should because all the animals are very active.
Really?
At nighttime, yeah.
Mhm.
Well, nocturnal.
Yes.
Well, the ones that are nocturnal are nocturnal. All right, let's see.
Did you just shake your phone and turn that light off?
Mhm.
Oh,
It's magic.
magic.
All right.
At
Oh,
least it's not
goodness.
hot in here today.
Yet.
Yeah.
Give it
will
four.
be.
Give it 4 minutes.
Really?
Oh yeah.
I'll just take my shirt off.
Yeah, just
Oh, there you go.
No
my outer shirt.
No. Oh.
honestly, we wouldn't care.
I'll just take it all
Turn your
off.
mic on, Tace, please.
Is this on? Because I don't know how to work this
Yeah, yours
shit.
is on. Yeah, that's
Okay.
why.
Yes.
Hello.
Okay, try it now.
Hello.
There you go.
Hello.
Oh, she got reverb today. With
Well, that was, yeah, that's from your.
mandolin.
Yep.
You reverb your mandolin?
I reverb everything.
Yeah. And I just realized we could probably cut the reverb down a little bit. You're doing pretty good.
The way I sound, I need all the reverb I can get.
Yeah, true.
All right, we ready?
Well, it's up to you. Are we ready?
I'm ready. Yeah.
Pretty close.
All right.
Sirius XM. It's time for Weird Medicine with Dr. Steve.
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve exacerbating my incredible woes. I want to take my brain
Oh.
and blast it with the wave and ultrasonic
We gotta do the insufferable bastards thing. You see that?
No, I didn't see it.
It's right above you, in the middle of the screen.
If I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want to
You see it where it says Insufferable Bastards Podcast?
Uh-uh.
You know, okay, in the chat.
Yeah, it's chat. Stacy.
Yeah, no, go all the way down to the bottom. There's 2 laughing faces and 2
Oh, gotcha.
finger
Yeah,
things.
yeah.
And right up above that says Insufferable Bastards Podcast. So we'll do that first since they're here.
Oh, okay, cool.
Okay? All right. Okay. I forgot to hit record, so that's fine. It's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio and the longest running show on this channel. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medicine practitioner who gives me street cred with the wacko alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And my partner in all things, Tacey. Hello, Tacey.
Hello.
And back from a prolonged sabbatical, everybody, DNP Carissa. Hello.
Hello.
This is a show for people who had never listened to a medical show on the radio. If you have a question you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call at 347-766-4323. That's 347-POOHEAD. Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy I can't mention contractually. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking over with your doctor, nurse practitioner, physician assistant, pharmacist, chiropractor, acupuncturist, yoga master, physical therapist, or whatever. All right, very good. Don't forget to check out Dr. Scott's website at simplyherbals.net, simplyherbals.net. And still the best CBD nasal spray I've ever encountered. Of course, it's the first and still only CBD nasal spray that I've ever encountered.
Exactly.
It goes along with the theme of the show, but it is amazing.
Thank you.
So check him out at simplyherbals.net. And all right, very good. Let's see. We did the Jenner retraction from last time. So I don't have anything. Well, you guys have anything?
No.
Nobody? Tacey, you got some topics?
I have some topics.
All right, here we go.
It's Tacey's time of topics. A time for Tacey to discuss topics of the day. Not to be confused with Topic Time with Harrison Young, which is copyrighted by Harrison Young and Area 58 Public Access. And now, here's Tacey.
Hello, everyone. We're going to have snotty topics today.
Okay, well.
Generally,
lovely.
just because I'm snotty. But
God, who isn't?
Yeah.
So we're in Upper East Tennessee. The dogwoods and all these flowering trees have opened up their flowers. They're beautiful.
Yeah, Bradford pears.
Yeah, Bradford, but that's the one.
Killing
That's
me.
the one that can kiss my ass.
Kill 'em. Ay, ay, ay.
So anyway, they it's supposed to be a freeze tonight, and I hope they all fucking die. God. Anyway, all right. So go ahead, Tace.
okay, topic number 1. In 2008, a man in U.S. was diagnosed with frowning syndrome. Facial contractions gave him a permanent frown. Resting bitch face.
Yeah, I was just going to say.
That's NBC News.
What? From NBC News? Frowning syndrome?
Yes.
Okay, so
I think I have that.
it's also known
I
as.
also have that.
Now, there are people with a genetic syndrome called Ochoa syndrome. They exhibit characteristic frown-like facial grimaces when they try to smile or laugh.
Ugh.
It's often described as inversion of facial expression. So when they try to laugh, I've seen people like that, where when they laugh, their mouth goes down instead of up.
Oh.
I think, a matter of fact,
Wonder if there's a Botox that can fix that. I mean, if they can, because they do the lip flip now.
that is true. I think what it would do is just make them not be able to smile at all.
Which would
But-
be better, in
Well-
my opinion, than frowning every time.
Maybe there are some famous people who have it that I've seen where they laugh and they like that, and they
Oh.
they probably
Now
look.
I know so much, yeah.
Yeah.
Let me think, who is that?
There's some famous people. Let me Google famous people with Ochoa syndrome. Famous. Oh, everybody loves this when I do this.
Oh, yeah, when you
People-
Google while we're on the
We're
radio.
35 seconds of the show and we're off
I
the
know,
rails
I know.
already. That's a new record.
Well, and then everybody that it gives me
all
here
my
is
fault.
nobody is famous.
That's exactly. Poor Chris.
Always my fault.
Yeah, it's
Yeah.
okay.
Let's see. Yeah, no one famous with Ochoa syndrome, according to Google. Anyway, okay,
All
very
right.
good.
So topic number 2.
That was it?
Yeah, she reads the headlines.
Oh, gotcha.
Yeah,
That's good.
so
It's fine.
the first
It's fine.
3 are just topics.
It's fine.
The fourth one
Yeah,
gets
it is
a little
Tacey's-
deeper.
Tacey's time of topics. It doesn't
No,
technically say Tacey's time of going
Well, it
into
depends on
depth.
where the information is coming from.
Right. Okay. Very
Okay.
good. Okay.
The second one is in 2012. A man had a 24-inch long tapeworm removed.
Oh, I thought that was going.
He
somewhere
lost a
else.
lot of weight and was malnourished.
Yes.
CBS News.
20. Okay, so tapeworms. Carissa, you want to talk about tapeworms?
No.
But their life cycle? No. Okay, that's fine.
But 24 inches, I thought that was pretty long, and that's
24
pretty-
inches?
Yeah.
Oh, that's nothing.
I thought we had somebody that had one that was, over
12
there.
feet or something.
Yeah, some ridiculous amount like that.
bizarre.
Well,
It's
screw CBS News then, because
a-
that was not a story.
Back in the day, a million years ago, before we had phentermine and Ozempic and stuff like that, people would take tapeworm eggs and to lose weight.
Not
Well,
opposed
they
to
still
it.
did that.
Yes.
Did they really?
Yeah.
I did not know that.
Who did that?
I feel like they still do that.
Yeah, I'm not opposed
You think
to
they
it.
do? Mm-hmm. You've seen this? Mm-hmm. Oh, really? Why would you do that when you've got other things like?
Well,
I mean,
you can't get Ozempic now because of the
oh,
whole
so they're
diabetic
taking
thing.
tapeworms. Look,
I would say
I
probably
mean-
fewer side effects if you use tapeworms
I
than
mean,
some of those other
honestly-
things.
well, maybe, but I mean,
Cheaper, easier access.
Tapeworm infection causes upset stomach and weight loss, not wanting to eat loose stools. Oh,
That's all that.
Not wanting to eat loose
Ozempic
stool.
causes the exact
Same
same thing,
symptoms.
Isn't that
except for a
interesting?
little bit of constipation.
That's what I'm saying, dude. I think you probably have fewer side effects from the tapeworm.
Cravings for salty food. So I wonder if the tapeworm likes salt and somehow it's kind of controlling you to eat certain things that it likes. Oh, how creepy is that?
That's
I
pretty interesting. If it can control what you
Now
want.
we've got her attention, Dr. Steve. She's in the game now.
Yeah,
I'm in.
tapeworm life cycle. So how do we get rid of them? Medication. And it's very easy to,
And do you poop them on out?
yep, that's what you do.
Do you poop them out alive or dead?
Well, they die and then they let go and then you poop them out.
Oh, so they're
and they
attached.
have,
Of
and
course they
actually,
are.
you're pooping out segments of them
Oh,
constantly.
nice.
Yeah, let's look up
Fun.
tapeworm.
Like normal people
Have you ever
are?
seen dogs that have worms?
Yes.
And when they poop them out, it looks like a pile of spaghetti noodles.
Oh, no, that's probably roundworms. Yeah,
Yeah, but
yeah.
it's still a worm in your tummy.
Google. Okay, you want to Google image something that will make you vomit, as we say in Upper East Tennessee, is Google rectal ascaris. Ascaris is a type of roundworm, ascaris. Well, matter of fact, I'm going to counsel you not to Google that.
I've done it once, and that was
It's
enough.
too late.
Yep, I've
And
done it once,
we
and was
use
plenty.
that. We use the picture that you're going to see with the guy spread eagled on his stomach with worms coming out of his ass. I mean, it's just giant mass that looks like thick spaghetti. That we used that on the album cover for my grindcore band, which was called Ass Maggot. So
there you
there you go.
Nice.
Yeah, the life
of the
cycle
day.
life
So
cycle
proud.
of tapeworms includes the egg, a free living larval stage, a procercoid, and then a plerocercoid in the first and second intermediate host. So this is very complex. So humans ingest raw or undercooked infected meat, and then the tapeworm grows, and then they crap out these eggs and things like that in the feces, and then cattle accidentally eat it because they're eating vegetation that's contaminated by it, and then they hatch and penetrate the intestinal wall and circulate to the musculature. That's I was saying it the way
Yes.
what's his name? George Takei says it. Musculature. And then they these spheres develop into what we call cysticerci in muscle tissue, and then people eat them, and then rinse and repeat. Now, humans can sometimes get the cysts growing in their muscles is extremely painful when that happens. And that's if you accidentally eat contaminated vegetables that have been contaminated by stool from either an animal or a human that has had tapeworm infection. So if you skip going through the pig, then you end up getting the cysts growing in your muscles. I've actually never seen that. I've seen a picture of it. You take a picture, an X-ray of someone's arm, and you'll see all these little sort of cyst-like things in the muscle tissue. It's
Wow.
gross.
Yeah, it's terrible.
Yeah.
That was a good one.
Topic
too.
number 3.
All right.
In 2010, a woman was diagnosed with Stoneman syndrome.
Oh yeah.
Produced excess calcium deposits in her muscles, leading to muscles and joints becoming very hard and stiff. Science Daily.
Okay. So
Hey, this
It's-
next
it's
one
fine,
is more
it's
than
fine.
just a topic, and I don't
It's
care
fine.
if you think
No,
it's
it's
fine. It
topic
just
time.
is what it is.
That's a good topic.
Stoneman syndrome is also called fibrodysplasia ossificans progressiva, or FOP, or FOP.
Eey.
It's extremely rare, 1 in 2 million genetic disorder, and it's characterized by ossification of the skeleton and connective tissues. We call that ectopic ossification because ectopic just means it's somewhere where it's not supposed to be. And it leads to progressive fusion of the skeleton all over the place. And if you Google image someone with Stoneman syndrome, they've got skeletons of these people that's all just like one bone, basically. It's rough. You ever seen anybody with that, Carissa?
Nope.
No, me neither. Another one I've never seen.
No.
I have seen one case of tetanus, though. I'm the only person I know in medicine that's actually, other than the people who were on that case, and some of them are dead now because it was so long ago, that have actually seen a case of tetanus. And why is that? Not because tetanus is gone.
You're
because
old?
we're fully vaccinated. Well, yeah, that's why I've seen one. But why we don't have them is because we vaccinate
Right
against
on.
tetanus.
Right on.
So,
That's good.
thank you.
Yeah, it's very good.
Oh, the tetanus shot causes more problems than tetanus. Yes, of course. Of course it does, because we have 0 cases of tetanus, and we vaccinate everybody. So how many cases of tetanus did we have in this country last year? Let me see. Cases, oh, here we go again, of tetanus
Here we go.
in the U.S. All right. So 33 last year.
Wow.
Okay.
So are
it's
you off
pretty
your
low.
high horse?
I am.
Okay.
Yeah.
Topic number 4, which is also a story,
But also a topic, right?
also a topic,
Okay.
sent to me by Scott.
Oh.
Oh.
How do you get pregnant when already pregnant?
Excellent. You ovulate and then have
Is
intercourse.
This Tacy topic time or
Mm.
Steve?
I thought you were asking a question.
That's the topic.
Okay. Oh.
If I had a bill, I'd give you a bill right now.
Okay, I'll give you a bell. I'll give you a fucking bell.
Give thyself a bell.
Damn it!
You see
I
what
was
you just
trying
did?
to be Mr. Nice Guy.
Yeah.
Look what happens.
It's called superfetation. It's very rare, but possible. It's unlikely because, 1, you stop ovulating. 2, it gets tough for another fertilized egg to implant once the first one is nestled
that's
there.
for real. Yeah.
The uterine lining thickens to support the first egg, which makes it hard for another to attach.
Yep.
3, you produce a mucus plug, which protects the uterus from infection
Oh, yeah.
and keeps sperm from passing through.
Yeah. So that's 1 in how many? I've never heard of anyone ever getting pregnant while they were pregnant.
Well, I haven't either.
Well, let's
So-
see if it's further on down the line here. What causes it?
Okay.
What if you ovulate
Having
while
sex and getting
pregnant?
pregnant while you're pregnant, I guess.
Yeah, yeah.
What if you have 2 uteri?
Yeah, that happens sometimes.
Or it could be a didelphic uterus.
Well, that's
2 separate uteri, more likely to cause a miscarriage, though.
That's true even if you only have 1 pregnancy in a didelphic uterus. That's one that's kind of blooped into 2.
They're usually conceived 2 to 4 weeks apart.
What's the name of this pregnancy?
Superfetation.
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 Yeah,
Yeah.
according to my handwriting,
Okay.
Yes.
which
Okay.
could be wrong. Timing, usually
Oh, superfetation.
Fetation.
Okay, like
Oh,
Fetal.
excuse me.
extra fetuses.
fetation. Usually conceived 2 to 4 weeks apart. A handful of
damn it.
confirmed cases. Number 1,
So rare in humans, only 10 confirmed cases. Wow. Yeah, go.
Jessica Allen. She was a surrogate. She had quote unquote twins, but after DNA testing, it showed one was hers and the other was theirs.
Really?
Mm-hmm.
So she
Ju-
got implanted, probably had an agreement not to have intercourse, and did it anyway.
Did it anyway.
Now, how far apart were they? Like in weeks? I mean, I guess you could have one that's 16 week, or much smaller than the other one, and they deliver them separately.
I'm
How
unable
the
to
hell does
provide
that
that
work?
information at that.
That wouldn't work. Yeah, unless you did maybe a C-section. You have to keep them from going through labor.
Well, it sounds like she had them, but then they DNA tested them.
Right. So that they were close in.
Yeah.
But if you had one that was, say, 40 weeks and one that was 32 weeks, well, one that was, let's
It
go
typically
farther.
only happens 2 to 4 weeks apart.
Okay, thank you. That answers my question, because, like, how could you have that happen when one fetus was 22 weeks and the other one is 40 weeks? And then you'd have a real problem on your hands.
Another famous person was Julia Grovenberg. 2010, conceived second. 2.5 weeks later, babies growing 2 different rates and 2 different uterine sacs. 2 different due dates, but by cesarean, they came on the same day. Number 3 was Kate Hill.
Unlike the father.
Yeah.
I'll give myself a
That
bell
is
on that
so
one.
funny.
Give thyself a bell.
Number 3, Kate Hill. 2 babies 10 days apart after getting treatment for PCOS.
Okay. Polycystic ovary disease.
Interesting to me.
Yeah.
So it happens so infrequently, doctors haven't been able to really study it or say if risks are higher.
Yeah, this thing here says the chance that you'll be affected by superfetation is close to 0, because you got people Googling shit and just going, is this going to happen to me?
Probably not.
Yep.
That's the end of topic time.
That's a good, very good topic.
Good
time.
one, yeah.
It's Tacey's time of topics.
All right, very good. Thank you, Tacey.
You're
I
welcome.
still have to get you an outro. I'll work on that. Scott, you got anything?
I've got a couple questions from the Fluid family.
All right,
when
that's
it's time,
right.
When it's time.
Yep, we had one from who was that?
The podcast guys?
Yeah, podcast guys. Who
Insufferable Bastards.
Insufferable Bastards
Yeah.
podcast.
Yes.
Yeah, what you got?
Well, they went to, I guess, one of their friends, Ray DeVito.
Yeah, Ray DeVito.
Okay.
He's a comic. He's on Misery Loves company.
Gotcha. Never heard of it. I'm sure it's a good show. but-
MLC. It's with
Yeah.
Kevin Brannon.
Okay, cool. Yeah. But
Everybody, Scott's not being disrespectful.
No, I'm
He's-
not
he's
at all.
Literally,
Not at all. I have
literally
no clue.
not
Yeah.
plugged into this
Yeah, that's not
world
bad.
in any way. So
yeah,
it's one of the reasons he's on the show.
Yes, I can play the dummy. So anyway, so poor Ray though. I feel sorry for him. He's I guess a brother of mine. He has the gout.
He got the gout.
Oh, the gout.
Yeah. So these insufferable bastards want to know what exactly is gout.
Yeah, gout sucks.
Gout
Does
is
suck.
Is what
total.
Dr. Scott has gout.
God, it's just.
And I can always tell when he's
Talk
been
about insufferable.
drinking or eating. What is it that triggers you? Shrimp?
Shrimp mostly.
Yeah.
Yeah, but sometimes just really sugary things can do it too. So it's, but shrimp tends to do it the worst. I haven't had shrimp in a couple of years.
Is that right?
Yeah, last time I had shrimp, I had
It's so good though.
a shrimp and capers pizza from our favorite Italian restaurant here locally, and a couple of large beers. And I woke up the next morning. I was like, hellfire.
Yeah.
I was looking for a hacksaw because it would have not been as unpleasant.
Yeah.
But but gout is a form of arthritis called it's caused by hyperuricemia. So you got
very
too
good.
much
All right. Where is
uric
the
acid
damn
buildup
thing?
in your
That was
body.
an easy one, and he does not deserve that.
I get a bell.
That's correct.
So,
So-
but and if you have too many, and if you eat foods high in purines, they tend to lodge in your joints, and they can lodge anywhere.
Yeah.
And the way I describe it to people is, if you can imagine those medieval weapons where there was a stick with a chain, and on the end of the chain was a metal ball with metal spikes sticking up. You can imagine a couple hundred of those stuck in your ankle joint, or your toe, or your knee, and when you're walking, that's kind of
A couple hundred of them.
Yeah,
It'd be awfully big.
No, they're teeny.
Yeah.
They're teeny. Yeah, that's what it feels like. Because it's not really glass cutting sharp, and it's not really a stabbing pain. It's more of just a horrible, miserable. Yeah, it's an awful thing. So
does it make you want to vomit?
Now, do you always get it in the same place?
Yeah. So mine started in my big toe, which it usually does.
Yep, that's a common place.
Very
not
common,
the only
but
place.
not the only place. Yeah, and you can technically get it in any joints. And I tell people that you think it hurts when it's in your big toe until it moves to a larger joint,
like your knee,
or like I have it in my ankle. My ankle, I get it a lot.
Yeah.
So I get it there. I get it in my toes, my middle toes on the other foot. Sometimes I get it in my hand occasionally. It's pretty nasty. So I have to be really cautious with what I eat and drink, of course.
Well, you're all fucked up.
Yeah, pretty much. Yeah, no, I've been like this for a long time now.
There's two ways you can get a high uric acid level in your body. You could either produce too much, or you can excrete too little.
Right.
So back in the day, before people went to sort of cookbook medicine, we used to get a 24-hour urine on people and see if they were over excretors or over producers or under excretors. And then if you didn't produce enough, if you didn't excrete enough, I would give you a medication called probenecid, which was dirt cheap, and it just made you piss out
Yeah.
gout.
You can
I mean,
kind of
uric acid.
You kind of see it almost gets you a little foamy urine.
You had to be very careful
Yeah.
because in the beginning, if you precipitated out a bunch of uric acid from your bloodstream, you could get uric acid stones. So you had to take medication called potassium citrate to change the pH of your urine so that didn't happen. And then, if you were an overproducer, you would take something to stop you from producing it, which back in the day was allopurinol.
Right.
And now that we've got Uloric and other things like that, but if you take that stuff during an acute gout attack, it'll actually make it worse, which is
Allopurinol.
weird.
Right.
Right.
Yeah.
So during an acute gout attack, we'll use colchicine,
Mm-hmm.
which stops white blood cells from producing tubules so they can't move around. Well, how the hell that helps it, I don't know.
Yeah.
But you would take enough, you'd keep taking it until you got sick to your stomach or shit your
poop it
pants.
out. Yeah, you poop it out.
And then you would stop. And or you can just do non-steroidal anti-inflammatory drugs like indomethacin or even
Indomethacin
Motrin.
works really well, but it's really strong.
Yeah.
Steroid, sometimes just low-dose steroids
yeah.
can help as well, too.
Use steroid dose pack.
But I apologize. I didn't mean to talk over you. I was just going to say, but as far as
Hell, you're the gout expert.
Yeah, if Ray doesn't know a lot about it, really the key is being active and mobile. The more you walk, the more active you are. Typically, the less those little crystals will lodge in your joints.
Yeah.
Of course, being really cautious with what you eat and drink is a key. Beer is a flare. Yep. Yes, ma'am.
Okay, so the FDA has ordered that Uloric no longer be used as a first-line treatment.
Oh, okay. Oh, and as a first-line treatment.
Instead,
right.
it should only be prescribed to certain patients who cannot take allopurinol
Right.
or who experience severe side effects from it,
Yeah.
from allopurinol.
Very good.
Yeah.
Thank you, Tacey.
Thank you,
As a
Tacy.
matter of fact, okay. You got a medium bell.
Hearken to thine inner voice and give thyself a bell.
You know what? You gave me the first one, and
yes.
you can suck it on the second.
Oh, man.
So let's talk about the things that you want to avoid.
Yep.
So Scott's alluded to some of these already, but red meat, some meats are high in purine. So what happens is your body breaks down purines into uric acid, and then too much can get into the bloodstream and cause these gout attacks. So red meat has a higher purine content than white meat. But of the red meats, anybody know which one is the worst?
Of the red meats, I would say any kind of wild game, and I get that from Sean. Someone said he gets flares of gout when he eats wild meat, wild
Well,
game.
okay. But of the common meats,
Oh.
does anybody know which is the worst one? One that you could buy in a grocery store?
Hamburger.
Nope.
Dang it. There goes my bell.
Anybody? What?
Nope.
Nope. Carissa? Okay.
Chris fell asleep about 7
she-
minutes ago.
It's fine.
She dozed off.
It's fine.
I think the wine's kicking
I
in.
don't blame her. It's lamb. Lamb
Oh,
is
okay.
the one.
So is shrimp common? Or is
Why
that
lamb?
Very common.
Why lamb? I don't know. It just its purines are easy to break down into uric acid, I guess. I don't know.
Yeah.
I don't know.
or is shrimp just a thing that Scott's just got?
No.
No,
That's
fish.
very common. No,
Is
Certain
it? Shrimp
fish are
is
rich
a-
in purines.
yes,
Okay.
especially shrimp. Yeah.
Okay.
Some of the shellfish. Yeah.
ahead.
Also, yeah.
Go ahead.
Yeah. Well, I was
You're
gonna
the
say-
expert on
Yeah.
gout.
Well, I say a lot of shellfish actually can have higher levels of purine. But shrimp is the number one.
Herring, tuna, mackerel, sardines, anchovies are bad. If you're eating sardines and anchovies in 2023, you deserve to get gout. Now, does anybody know what the best alternative for fish eaters? Scott knows the answer to this.
The best alternative for fish eaters, tofu.
Well, okay. Yes, but I mean as fish. Which fish would be the best if you were going to eat fish? That's
Oh,
what I
salmon.
should- Yes, there you go.
Give thyself a bell.
That's
There
exactly
you go.
right. Okay, very
Are
good.
we even?
Suck it.
People
yes.
with gout should eat fish no more than twice a week, however. Now, Scott should get another bell for this because he mentioned this wild game, high in purines and is really problematic. Rabbit,
Should
venison,
get, but
quail,
didn't
venison.
get?
Well, didn't because he answered it at the wrong time, but
It's okay.
that's
It's
all
okay.
right.
I have no bells.
That's okay. Get used to it, sister. They'll all be coming this way. So yeah, but I would.
Scallops are bad. Organ meats.
Scallops
Why
are
are,
delicious.
why are you eating organ meats?
Yeah, I don't know. Yeah, but I would tell Ray, make
But
sure he
God,
stays
that's-
hydrated. Make sure he stays very active and doesn't,
Yeah.
gain a lot of weight. Weight does add to things.
And if you're drinking beer, stop it and
Yes.
drink something else.
Yeah.
skip alcohol whenever possible, but you can have it says here, an occasional glass of wine. Boo.
So Scott, I've seen you drink beer. Do you chance it with
He
beer?
owned a
or do
beer
you-
store.
Yeah, very, 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 very limited beer nowadays.
It's probably
Really?
why we don't own a beer store anymore.
So what do you
Well, that
what do you drink?
ran into the
Anything or
ground.
do you drink anything?
Yes,
or-
you know, like any kind of smart person, I'd change from beer to tequila.
Oh,
Oh yeah, that's what you do.
Or vodka.
Yeah,
Vodka.
anything like
okay.
that.
So
Kombucha and
No,
vodka's
what I'll
good.
do is just I will have maybe one or two drinks, but that's about it.
okay.
Yeah, because anything can flavor
Can
it
you
up.
please
now.
stop bullshitting
Even vodka
and
and
get to the question?
tequila?
Occasionally, yeah.
Okay.
Occasionally. And Sean is demanding that he gets part of my bill too, since he did say the wild game.
Okay. Yeah.
There you go,
So
Sean.
I know it
Give
hurts
thyself
you.
a-
and I know you wouldn't
Oh,
want
it's
to
awful.
do it.
Oh, it's
I mean, anything that would cause it.
What about
It's
vegetables? So you should eat a diet rich in vegetables,
Yeah.
but there are some to avoid.
There's some, they say, but in my experience, and I've seen a little bit of research on the vegetables don't tend to have near the effect as
Right. No, yes.
yeah. But like asparagus, they say can cause
It's
Give thyself
nasty
a bell.
anyway.
ooh.
Yeah, asparagus.
Shut up.
Tacey, you got any ideas on vegetables or Carissa?
No,
Okay.
I'm mad at you.
God. Okay, well, what else is different?
This is a normal occurrence here.
This is for myself.
Man, you are one pathetic loser.
That's for me. So, yeah, mushrooms, peas, spinach, and cauliflower.
yeah. All the things I love.
I know,
of
I would be
course.
screwed
Oh my
on
gosh,
that one.
it's awful.
Yeah, except for me.
But it's better than gout. I can promise
Yeah,
you that, man.
I know it is.
Jeez
I've seen you
Louise.
with it.
All right. And then the fruits that really don't matter because it's like dates and prunes and shit like that. But plums and pears are on that list as well. So, and that kind of sucks.
Yeah, and anything
Those are yummy.
high fructose corn syrup stuff, so you really do need to lay off any of
They did say that.
the beverages that have.
Although,
high
okay,
fructose,
let's
yeah.
for 1 second, let's review high fructose corn syrup. So,
Yeah.
so table salt is sucrose, right? What is
Table
sucrose?
sugar?
Table sugar. What did I say?
Yeah,
Table
salt.
salt. Okay,
No, that's
I
okay.
gave myself-
We know what you meant.
Yeah.
I was just making sure. Yeah.
Yeah, that's good.
Well, that's because you're an idiot.
So table sugar is a disaccharide, right? Mm-hmm. Everybody remember this from chemistry?
Nope.
Comprised of two different sugar molecules. Does anybody know what they are?
Disaccharides.
Shit.
Take a bell.
I'm taking a bell away.
Oh.
You see? You're stupid minds. Stupid.
Taking I might erase all
Glucose
those.
and
Yeah.
fructose.
Fuck yes, there you go.
Give thyself
Oh,
a
for
Okay, everybody's
fuck's
getting sick of the
sake.
bells, but yes, that was correct. It's
you.
glucose and fructose.
Right, put 'em
So table sugar is what? It's what percentage of table sugar is fructose?
At least 50%.
Yes, it is exactly 50%. So high fructose corn syrup is anything that's more than that. Sometimes it's like 51, 52%.
Okay.
So people who get all high, the problem is sugar. It's not high fructose corn syrup. It's not, unless it's really high, fructose can be a problem by itself for some people, but it's just sugar in general.
Right, yeah.
That's very normal.
Yeah, I was going to large amounts of sugar.
Yeah.
Yeah. To be
High-fat dairy products are another one, and those kinds of things. Now, Ray is pretty thin, so this won't apply to him, but weight loss can also help with that. And Scott's thin, so that one's kind of a bullshit one. But I guess if you're a vegan and you're having these kinds of problems, so
I know it sucks.
all right, okie doke. All right, and Ray can reach out to me anytime to and we can discuss this further.
Yeah.
All right. I got anything else from the Fluid family?
Yeah, somebody. Let me see. Let me go back here just a bit.
By the way, if you don't know what the Fluid family is, that's the name they gave themselves. It's of folks who are in the waiting room, which is basically our YouTube channel, chat, and just subscribe to our channel. And when we are live, we don't make a big deal out of the video aspect of our broadcast because we're really a radio show. But if you'd like to join us while we're recording, then you're more than welcome to. And they seem to have a good time over there. So more fun than I'm having.
Yeah. Oh, Dennis Dunn heard you mention what you're taking the prescription medicine for your energy in the afternoon.
Okay.
And he was wondering if you take it every day, is it a bad thing? Can you get addicted to it?
You're talking about modafinil?
Yeah.
Yeah. Okay. So I'm on 3 different ones, and I just tried a 4th one today. So I have narcolepsy, or I have excessive daytime sleepiness, which is one thing, but I also have narcolepsy, which is just basically where my brain is trying to kill me when I'm driving down the road, and all of a sudden it's trying to make me fall asleep. It's like, dude, why?
Yeah, makes no sense.
If I die, you die too. And when you're driving down the road and you're using your eyebrows to keep your eyes open, and it's like this shit. I mean, what in the, and my eyes are fluttering up and down, and I have to pull over, and
scares me.
Scares you.
Yes,
scares me that you're not gonna.
You'd be fine, but anyway,
I would not.
So I'm on 3. I tried 3 different medications. I've got modafinil, armodafinil, which is Nuvigil, modafinil, which is Provigil, and then Sunosi, which is the newest one. And I can't remember the generic. And then today I tried Fatigue Reprieve. And I'll be honest with you, Dr. Scott's stupid Fatigue Reprieve worked as good as any of those.
It does really, yeah, I love it. I actually take it pretty regularly.
Well, yeah, you're biased, but I'm just saying,
that's true.
I was biased against it,
right?
And but I found it to be just as effective. I did not fall asleep on the way home. I don't know what the hell's in that shit, but it did make me I was anxious today, so I'm going to try it again and see if I get anxiety again. I'll know that may be, an adverse effect. That's no big deal. It wasn't crushing anxiety.
No.
Just a little bit.
It has a little bit of ginseng and a little bit of astragalus, for sure. It really does have astragulus in it.
Of course it does.
Wong
Everything you make
Chi,
has astragalus in it.
Good for you.
But
Makes you big and
so
strong.
what are these things? What was the hype when you created this? What was the thought of putting all those things together?
It was
Just
based
a little of this, a little of that.
No. It was based
Okay.
on old Chinese formula called Buzong Ichi Wan.
Oh,
yeah,
okay.
literally, yeah.
Yeah.
It's no middle kind of chi that doesn't come up. So it's like your energy is low and it's trying to boost your energy up.
Yeah.
So it's Bu, no, Zong, center, chi.
Oh, really?
Yeah.
Oh.
So then I kind of tweaked it a little bit and added a couple things. Increased astragalus and increased ginseng.
One thing that he uses in some of his traditional Chinese medicine, DNP Carissa?
No.
Flying squirrel fecal matter.
Yes, I do. It's very good for you.
Well, that's
it's good for your
because
stomach.
you're an idiot.
It's good for your stomach. That's what you use
That's
it for?
what you use it for.
What the hell?
I don't know.
Why?
I
Because-
wouldn't give it to anybody that's pregnant or anything, but yeah, it does help someone with
How
nausea.
did you find this out?
Going to school.
Yeah, he did
studying
4 He did 4-year Chinese medical school. That's why.
Literally, yeah. We had it in our pharmacy in a little glass jar.
It's
along
sterile.
with many other things.
Fair. I'm just curious who and why we first.
Yeah, why would they look like little pills? They go, ooh, it looks like a pill.
Like, let me just take this and see what it does.
I know. I don't know. I don't know where they got a lot of those things. Probably just didn't
Be
have
interesting
much.
to
Well,
know.
you just eat everything, and then some of it has certain effects, and then you write it down, pass it on to the next generation.
Well, and I think a lot of it comes from just watching nature, watching animals.
Fair.
They eat something and they scratch their back on something. It's like, well, maybe they're doing that because it's helping.
Yeah.
I don't know.
Yeah.
And the other thing is with homeopathic. I don't know. I heard that too. Homeopathic medicine. What they used to do with those is they'd have people, they'd just line them up and they give them these little tidbits of things and they have them report what they're feeling. And
Well, that's a way
they
to
just
do
write
it.
it down. Yep. That's a true story.
So this flying squirrel feces, though, it's sterilized, right?
Yes.
Okay, you don't just pick
no.
it out the squirrel's ass and pop it in
But
somebody's
it
mouth.
still smells like shit, though.
Does it?
Hell yeah! Once you put it in tea and
Fatigue
boil
Reprieve smells a little bit.
Nah,
like
watch
shit.
it now. It smells like roses.
No,
That's good for you.
It wasn't bad.
That's good for
It
you.
wasn't bad. It didn't have a bad taste or anything.
No, shoot, no.
All right. Okie doke. Carissa, did you bring a story?
No.
Nope. Okay. That's
Way to go, Carissa.
There you go. That's
I'm
fine.
just
We like
on
you.
top
See,
of things
we like
today.
you.
No, I'm just asking. I'm not saying you should have. All right. So you guys ready to answer some questions?
Yeah, let's
Other
do it.
questions? Okay. Let me see.
Number one thing, don't take advice from some asshole on the radio.
Okay. Let's do this one.
Hey, Dr. Steve.
Hello.
I wanted to ask you, my Framingham risk for a heart attack is 1.4%.
Excellent.
But my CAC score by coronary
Artery calcium.
score, I think it is, can't remember what it stands for, is 113, which I think is moderate risk. So how do you square that low risk of Framingham with the CAC score?
Yeah, okay, very good. So the Framingham, we've done a bunch of times on this show for people. You take your cholesterol and, is your blood pressure elevated and do you have other issues like that? And then you mush it into a calculator and it spits out a risk score. So hers was very low. But she did a coronary artery calcium score that was deemed moderate risk. Now remember, these things are all just screening tests. The true gold standard is cardiac catheterization, which we don't just do on people unless there's a good reason because it is very invasive. So this coronary artery calcium score is one of the stronger cardiovascular risk prediction markers, and it is through multiple comparisons, it seems to perform better across a wide range of Framingham risk categories, 6% to 10% and 10% to 20%. So 6 to 20%, 10-year risk categories. But it hasn't been correlated with people that have an extremely low Framingham score. So it's hard to answer this question. It certainly seems to perform better among people where Framingham risk score doesn't perform well, and that is young subjects and women. So in this person, I'm going to rely more on the on the calcium score. So people may say, well, what's the calcium score? You go in and there's a CT scanner and they turn the thing on in between patients basically and run you through it. And it's just one time through. It literally takes 30 seconds to do. And then
Any contrast or anything?
Nope.
Okay.
Nope. And they just come up with a number.
Oh, wow.
And the number, the lower the number, the better.
Cool.
So when I did my first one, my number was 0. And then when I did it the second time, it was like, it was 200 or 150 or something like that. So mine was going up. But that's expected with age, because I'm fucking old. But anyway.
It's been a while since you've had that thing, though, hasn't it?
Yeah, I might.
A couple of years.
Talk to my primary about doing another one because he believes in them. And but anyway, it is a pretty good test. Weirdly, you can get cholesterol check, and your insurance will pay for that. And you can get C-reactive protein, which is another one, and your insurance will pay for that. But it, most of the time, won't pay for a coronary artery calcium score. So I'm hoping as time goes on that those things will be covered. But most places understand that. Mine was $50. I've seen it as high as 150, but no higher than that. So you can self-refer. You can ask for it yourself.
I think it's good. Well, money well spent.
Yeah, I agree.
Yeah,
I agree.
I think
Now,
so.
it will not pick up soft plaques. So if you have soft plaques, which are non-calcified, atheromas, then it'll show up as 0 or lower than it should be. But again, screening tests that's what they are. They're screening tests, and they're inherently imperfect. But excellent question, though.
Very good.
All right, here's one for any of us, I think.
Hey, Dr. Steve, why does one side of my nose always get stuffy and I can't breathe out of it?
Is that somebody trying to pretend that they're somebody else?
I think they're trying to pretend where they're not somebody.
Okay. Well, anyway, so this person has a one side of their nose is stuffy and the other side isn't. Anybody have any ideas on that one?
I have another question. Why is one side always runny and the other side is not?
There you go. That's a corollary.
Deviated septum.
Give thyself a bell.
Yes.
You know what, though?
That's
What
the
if you've
first
had
one.
your deviated septum fixed and it still does that?
Yours is still doing that?
Yes,
Really? So one side is runny and the other one isn't?
that's right.
Has anybody looked up your nose recently?
No,
Okay.
I'm not doing that again.
Yeah, that
Well,
hurt.
DNP Carissa can look up your nose and see if you've got a polyp or something in there.
I probably do.
I hope so.
Yeah, you do.
Maybe it's just your sensitive side.
Oh, God.
take a bell from him.
No, well, I've got somebody that I could afford to give away. I guess probably.
But it's most likely a deviated septum. The septum is cartilaginous barrier between the two nostrils. In most people, if you never snorted coke, it's solid all the way back. And if you have multiple times, you may actually have a hole in your septum. People have that. Or if you've had piercings that go through the septum.
No coke, no piercings.
Yeah, no, I know. I'm just describing what
Well,
the nasal septum is.
I have a deviated septum.
Do you really?
Mhm.
And you never got it fixed?
Can you plug one side of your nose and breathe and then plug the other one so we can see if we can hear the difference? Like, Okay, that's one side. Oh, you have much more flow out of that one.
Yes.
Okay, so I would assume that your septum deviates to the right then.
See,
Am
I got a
correct?
free
Yeah.
nose job with mine.
Yeah.
So it
Well,
was perfect.
You had a concha bullosa, which is the
And a
just this-
deviated septum.
Yes, she had all kinds of mess
I was
going
all
on in
kinds
there.
of mess going up in there. But
And then her guy her ENT had a crush on her, and so he did a nose
he
job
did
on her
not
at
have
the
a
same
crush
time.
on me. He's
Still-
a
and he
very
still
nice
does.
guy.
Well, you can't blame him, can you, Taste?
No,
you
not
can't
really.
I mean, come
But
on.
so, I mean, he just was like, he just lit up when I said, how much would it cost for a nose job?
And
He
he's
was
like, for you?
nothing. And I was like,
Nice. Who was this?
hell yeah.
We'll tell you after.
Maybe I need to go there.
We'll tell you exactly after the show.
Okay. So, so that's what that is. And just get somebody to look up there if they're severe enough. Sometimes they'll do surgery on them to fix them. Right. And for a lot of people, that is the greatest thing that they've ever done. Because
It really works.
I've had people come back to me say, "Oh my God, I can breathe out of both sides of
For
my
the
nose."
first time ever in my life, I could breathe. It's like I could breathe a Mack truck through my nose. Like,
pretty
just
awesome.
bring it on,
That's-
I can breathe it.
Yeah.
Pretty awesome.
Really.
Bring on that air. I can breathe it.
I mean,
And we've
for
got
the
another
first
great
time
question
ever,
if you
yeah.
That's awesome.
If you need a question, I've got you one.
Well, okay, we do. We have one for you, but go ahead.
Yeah, well, I was going to say, Ty is asking, his wife is 47 years old, was recently diagnosed with rheumatoid arthritis.
Oh.
Any advice on pain management and getting her energy level up?
Yeah, get it treated.
Well, I was going to say, can I?
Yeah,
can
go.
I say the
Yes, of course.
the non-pharmacological,
Yeah.
before she goes to methotrexates and
She
lots
ain't
of
gonna
steroids
go
and stuff.
Biologicals
But
these
you know me.
days. But yeah, go ahead.
A lot of the biologicals are wonderful. A lot of them aren't always tolerated. But before you go that route, there are some things that have been shown with rheumatoid arthritis. Dietary changes and in your microbiome and your gut health seems to make a huge difference. So if she's 47, maybe a little late for it to come on. Possibly, I would wonder if maybe she'd had some surgery where maybe some hardware or something was implanted. I would ask, but I would double down on diet, paying attention to the foods and that she eats and things she drinks, making sure that anything that causes any kind of inflammation. Again, my number one thing about chicken causing inflammation. I eat chicken, I get inflammation.
Really?
Pain, yep. And I've had dozens of people stop eating chicken, and a lot of the arthritis goes away.
Well, that's interesting. If you could pinpoint that, there are people with that alpha gal syndrome that get bit by a tick, and now they can't eat red meat. That's
Right,
for
exactly.
real.
Yeah, no, it's real. Yeah.
And that'd be an interesting chicken
Large protein
correlation.
molecules. Large protein
Stacey, were you
molecules.
going to say something?
Well,
I think Chris
my
had
mother
something.
has that. And,
Yeah.
a lot of that autoimmune stuff is hereditary, and I'm terrified of
Yeah.
that specifically.
Yeah.
So I've always gone to the gym and worked out and lifted weights to kind of help prevent that.
Right
But,
on.
I mean, what would you tell people to do to prevent that if they have like a parent or somebody
Yeah,
who's...
well, if they have joint destruction and stuff, they got to be careful. But
I mean, what if you don't have
you
it,
mean for you?
but you
Yeah.
want to prevent it? Yes, from
I'm a huge,
like if it's hereditary for
yeah,
you.
Yeah. And I would say number one, diet microbiome of your gut. Number two, huge fan of turmeric and curcumin. The natural anti-inflammatories seem to make a huge difference. And then number three, like you're saying, you spend a lot of time working out and exercising, and I think that's a huge benefit.
Yeah, but staying active. I'm looking at an article from Nutrients Journal. It's not some slag,
Mamby-pamby journal.
And it says, in recent years, increasing number of studies suggest that diet has a central role in disease risk and progression.
Yeah.
And
Well, since my mom eats jelly beans for
yeah,
breakfast.
I'm
lunch,
on a
and
new
supper,
diet. I
yeah.
just eat jelly beans all day long.
One
Or my-
meal all day. Starts at 7, ends at 10.
Yep. Yeah, that was the best one when she said that, yeah, I just eat one meal a day. We went on vacation with her.
Yeah.
And she was right. But it's exactly as Tacey said. Started as soon as she got up in the morning and didn't end until she went to bed.
Oh, goodness.
Just one meal. And there are several studies that show that people your mom's size have a lot of difficulty gauging how much they're actually eating. And there's ways that you can determine that. And there was a Hallmark study where they took people who had a BMI of 40 or whatever, and they had them estimate how many calories they took in. And they'd say, well, I ate this and I ate that, and then they'd run it. They'd just say what they ate, and they would estimate how many calories that would be. And then they did a thing called doubly labeled water, and what you can do with that is when you give someone doubly labeled water and have them piss in a cup, you can calculate from that exactly how many calories they took in the day before, and it was wildly different.
Oh, yeah.
They'd estimate, 1,400 calories, and they'd actually be taking in 6,000 calories.
So what's the normal age onset for rheumatoid arthritis? I thought it could
It can
come at any
time.
time, yeah, but...
Because I've been waiting on it because, autoimmune disorders are really fun and they're inherited, and it's just great to have like Hashimoto's and shit like that.
No, thanks.
It's most likely to show up between ages 30 and 50. So.
Oh, good. I got
you got one more year to go.
another year to go.
I'll say just a little like Chris had something.
No.
Yeah, I thought you raised your hand.
I just don't tolerate red meat.
Oh, yeah, no.
Really?
Mm-mm.
It doesn't give you the what does it give you? The green apple quick step?
Pretty much.
Okay. I'm looking here. It says several nutrients such as polyunsaturated fatty acids present anti-inflammatory and antioxidant properties, featuring a protective role for rheumatoid arthritis development, while others such as red meat and salt have a harmful effect. Gut microbiota alteration and body composition modifications are indirect mechanisms of how diet influences rheumatoid arthritis onset and progression. So, Tacey, you should be taking some polyunsaturated fatty acids into your diet, which you do because that's what I cook with. But possible protective effects such as the Mediterranean diet, vitamin D, and probiotics could be a possible future adjunctive therapy to standard rheumatoid arthritis treatment.
Right on.
So there you go.
Yep.
All right. I'm not going to give you a bell for that because I would just be giving you so many bells today.
Yes.
All right.
I thought I just had
Hello,
as
Dr.
many.
Steve.
No?
This is Mike from Ohio.
What?
Will you please give Dr. Scott a minute or two on your show to share the highlights of his badass baseball career?
No. Oh, it won't take a minute.
All right. Well, here's how much time we're going to give Dr. Scott to talk about his badass baseball career. Hang on.
Hey, Dr. Steve.
Exactly.
Can you explain the
Thank you very
difference
much, guys.
I'd like to
between
hear it.
No, hell no.
Alzheimer's? I don't know if I pronounced that right, but Alzheimer's and dementia, please, and thank you.
Yeah, sure. It's very
What
simple.
was the first of the questions, Steve?
He just wants to know the difference
Gotcha.
between
Gotcha.
Alzheimer's and dementia. So all Alzheimer's are dementias, but not all dementias are Alzheimer's. That's the best way I can talk about it. Chris, you're nodding your head. Can you list some of the other dementias? I'm putting you on the spot.
Vascular.
There you go. See, I just wanted to give you a bell.
Give thyself a bell.
See, nobody walks out of here without a bell.
No.
Yeah, so you got vascular.
I mean, I am a geriatric nurse practitioner. I should probably be able to just name them
Beginner's
all.
luck.
Okay.
Beginner's luck.
Well, what else we got? What are the kinds of dementia we got?
Dementia.
Parkinson's.
Yeah, Lewy body dementia. Very good.
Yeah.
Oh, yeah.
Give thyself a bell.
She's going to kick our ass.
No. I'm way up. I've got like 12 today.
No, you don't.
Oh, easily, at
That
least.
is so
my
full
God.
of shit.
I'm going to take the fucking bells
No,
away.
no.
The whole show's going to be about bells. So. All right. Yeah, so Lewy body dementia. There's a bunch of other frontotemporal dementia.
Alcoholic.
Yeah. Oh, yeah. Of course, Wernicke-Korsakoff syndrome. One of our friends from the old radio show suffers from Wernicke-Korsakoff, and she thinks that she is currently in the Navy.
Oh, goodness sakes.
On a naval ship, but she's in a nursing home. So there you go. Well, she's happy anyway, so that's something. All right, my friends. Thank you, Dr. Scott. Thanks, Tacey. Thank you, DNP Carissa, for gracing us with your presence today. Many thanks to our listeners whose voicemail and topic ideas make this job very easy. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, and get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks, everybody.
Goodbye, everyone.
All right. Now, not done. Do you want to do another question? We've got one on Ozempic for weight loss. We could come back to your baseball career, actually.
Oh, God, no. There's nothing to talk about. No. But thank you, though. It was great while it lasted. How about that?
Okay.
I've been taking Ozempic for weight loss for
Have you?
like months.
Really?
Mm-hmm.
Okay, you want to talk about it?
No.
No?
Yeah.
Okay.
Maybe. I don't know.
Well, I mean, we're
I'm
gonna.
not
we have
very
a question
good
about
talker.
it. Oh, okay. All right. Yeah, let's do that. Because, Tacey, you took Mounjaro, right?
I took Mounjaro and I'm taking Ozempic now, but I took Ozempic before I didn't like it.
Why?
Constipated me, made me sick.
Weird.
I couldn't brush my teeth. It wasn't about eating. It was like every time I brushed my teeth, I would throw up.
You'd vomit? Okay, well, let's save it for the show. Save it for the show.
Gag reflex.
She
I don't
does
know.
that anyway.
But no, it was
This
way
person
worse
vomits
on the Ozempic.
more than anybody I've ever met.
Just teeth brushing. It's like, bleh, bleh.
Yeah,
There's things you can do to help that.
Really? Oh, let's
There's
talk about that.
acupuncture,
Okay, stop.
right?
We're gonna
There's
bring this to the show.
Yeah, no, on your, I swear it is. Yeah.
We're gonna bring this to the show. Hang on. Okay, you ready?
No shit, really?
Okay, we're gonna talk about it on the show.
What have you been doing?
Acupuncture for gag reflex?
Hole in your shirt.
Oh, okay. All right, here we go. Stop.
I mean, I've done certain things. I don't have one.
Hey.
No. Oh, yeah, listen to him. Let's say him telling you what to do.
With those things
Don't
you
let
gave
him
me?
do that.
I mean, I zip.
With those things you gave
Don't
me?
zip.
Yeah. Okay, exactly. Yeah.
All right, let's talk about it actually on the show.
Well, if you would get it going, we
I
Roll 'em,
can't
baby.
until you guys. Okay.
Shut
All
the fuck up.
Here we go. Nope. You said it. I didn't say it. I'm not
Shut
saying
the fuck
that.
up.
Okay, here we go.
Fuck up.
Okay. All right, before we go, let's do. I think we've got one more here. Let's see.
Hey, Dr. Steve. I know you have done this before, but could we please revisit the use of these diabetes drugs when it comes to weight loss? I am
Okay.
54. I am not quite menopausal yet and struggling. And everybody I know, and I can name you at least 5 people,
Well, no, thank you.
are on this drugs and having great success. It just makes me nervous. And what are your thoughts on this for someone like me? And if so, if you think that's an option or something I should pursue, how do you go about talking to your primary without sounding like a bandwagon jumper?
Oh, no.
Thank you so
you're
much,
fine.
and you are so appreciated.
Oh, thank you. So let's talk very quickly. Let me set the stage, and then you guys, because half of the people in this room have tried these drugs. There's this class of type 2 diabetes drugs that improves blood sugar control, but actually leads to weight loss, and they're called glucagon-like peptide 1 agonists. And there are these other ones that lead to weight loss and improve blood sugar, or SGLT2 inhibitors. So now the SGLT2 inhibitors, Tacey, those are the ones that have been shown to increase the risk of Fournier gangrene. Is that right? It's the GLPs or the the ones that they're advertising right now, right?
Okay, so all I know about is Ozempic and Mounjaro.
Okay, well, you used to.
They're GLP-1s.
Right, that's right. Okay, so let's talk about the GLP-1s because that's where all the interest is right now.
That's where all the interest is right now.
So these are the ones that end with Tide.
Yeah, there's semaglutide and then The Mounjaro one, I'm not sure what
Well,
it.
Byetta is exanatide, and then Trulicity is dulaglutide, and et cetera, But Ozempic
And Mounjaro is tirzepatide, and I think that's very important to know.
Okay, very good.
The difference between those two.
Yes, absolutely. So these drugs sort of mimic this action of a hormone called glucagon-like peptide 1. And after you eat and blood sugars start to rise, these stimulate the body to produce more insulin, and that extra insulin lowers blood sugar levels. And it's not really clear how they lead to weight loss, except that you guys are going to talk about this. It has some sort of all drugs
Slows
just have
gastric
they have a whole bunch of effects. None of them are side effects. They're just effects. Some of them are positive, some of them are negative. And so it has other effects other than this. So go ahead, Tace. You started in.
Slows gastric emptying.
Yep. So
which makes you feel fuller faster.
There you go. It makes you feel like you're going vomit sometimes, right?
If you overdo it, and if you're a naughty girl or boy.
Yep. So now you've done the tirzepatide and DNP Carissa. You said that you had done the semaglutide. Is that right?
Correct. I'm doing it currently.
Oh, you're currently doing it.
Mhm.
So tell us how it's working for you and what kind of effects lead to the weight loss for you.
So I've been using it since the fall sometime.
Okay.
Since that time, I've lost approximately 50 pounds.
Wow.
Way to go.
And
you're going to waste away to nothing.
No. The biggest thing really is probably the slowed gastric emptying, because I'm a person who can like bored eat. I mean, if I'm like bored, I could just eat, and I can't do that anymore.
Yeah.
I don't crave sweets. I have a huge sweet tooth. I could have lived on sweets before Ozempic, and for whatever reason,
Really?
now I have to really want something sweet, and it's completely different sweets that I want. So I don't know if that's related or if that's just some weird shit from COVID still or what.
Yeah.
But the day after I take my injection, so I do an injection once a week, and the day after I have terrible reflux and nausea to the point I usually don't eat it all that day, which is a terrible habit. Not advocating for that. But that's the only day I have side effects.
Right.
Otherwise, I don't have any constipation, no diarrhea. I don't have any of those. However, I do know people who have struggled with both constipation and diarrhea from those medicines.
Well, the reflux makes sense. If you're delaying gastric emptying, you've just
Right.
got buildup of stomach contents, and it's hitting your lower esophageal sphincter. So.
And so, like, by the end of the week after my injection, I can, I guess, tell it's wearing off, because I'll usually eat like shit that day. And then the next day I take the shot, and then the next day I'm dying from heartburn.
Right.
So, I mean, it's kind of a vicious cycle that I do to myself. But
Yeah. But obviously successful.
Yeah.
Well done.
Just know if your family has a history of thyroid disease.
Yep. Yeah. Have you ever researched the thyroid connection with these things? Because they all the ads are all, well, if you have multiple endocrine neoplasia, and I wonder what the connection is. That I do not know. We should probably look that up.
Yes.
Maybe talk.
We
about
should
it.
look that up.
But not right now.
You know, I've asked you that 1,000 times, and
Yeah.
I
And
never
it
bothered
just
to
says
look it
that.
up.
It never says anything about Hashimoto's, which I have. And I've taken Mounjaro and Ozempic. I'm taking Ozempic right now. I just started it this week. But the problem with those two medications right now are it's such a big thing for people to take it for weight loss that the diabetics can't get it, which is causing a
that's
shortage.
problem, right.
And that's causing trouble for people who want to lose weight.
Well, they just need to make more.
They just can't make enough. And so my insurance actually denied, I'm on my last Ozempic. My insurance actually denied it for next time, but I have PCOS, so I have an insulin resistance issue.
Right.
Yeah.
Which is going to cause me some trouble because I've been on these medications for years And what now? I'm just going to let my insulin resistance just go wild, go crazy? I mean, I do worry about that.
What do they want you to take instead?
Well, they haven't said anything, and my physician's nurse doesn't know how to do a prior auth rebuttal. So,
well, I can help you with that.
I've got to go see him and let him know that there's an issue.
My insurance didn't cover it at all. I just paid out of pocket for it. It is so expensive.
really? Yeah.
Literally one pen, which would last a month, could range like $700 to $1,000.
Well, you can get it. Yeah. Do you know you can get it? There are Medispas.
Mm-hmm.
You know about that, I'm
Yeah.
sure. And so I have friends
finish that sentence. You know there are
that
Medispas.
work at these Medispas that are having it compounded.
Oh.
And so it's much cheaper. It's like I can't remember how much they said for the Ozempic, but for the Mounjaro, which I had no side effects on and lost 20 pounds, without blinking an eye, is $300 a month.
Yeah.
So you got to decide, and I mean that's a tough decision, especially if you kind of need it. You know what? Are they waiting for me to become a diabetic so that I can get it?
Right.
Because I can help them along with that.
Well, and I have all the risk factors. I mean, PCOS. I'm
you have
overweight.
PCOS?
Mm-hmm.
You do? Oh, well, you should be able to get that approved.
Correct. You
have
would think
glucose
so.
because of polycystic ovary syndrome is a disease of glucose intolerance. They need to diagnose it as glucose intolerance.
Correct.
/ prediabetes, and you can get it, and that's not a lie. They're just coding it wrong.
Yeah. But, I mean, I met my out-of-pocket deductible, and now it's like $60 a month.
Okay,
so.
well then. All right, never mind.
It's just,
That's
but not everybody can do
ridiculous,
that, though.
though.
And
No,
it
it
is
is
ridiculous
ridiculous.
to have to go through that. But
Yeah. I was looking here. Here's a meta-analysis, which is where they take a bunch of studies and mush them all together to get more data so that you get more sensitive answers. And these are all randomized controlled trials, and they were looking at GLP-1 receptor agonists, like what we're talking about, and the occurrence of thyroid disorders. And what they found was GLP-1 receptor agonists did not increase or decrease the risk of thyroid cancer, hyperthyroidism, hypothyroidism, thyroiditis, thyroid mass, or goiter. But they said due to the low incidence of these diseases, the findings need to be examined further. So this isn't conclusive, but it should make people feel a little bit better about it. And particularly if you don't have thyroid disease, but you got a family history and you're worried about it.
Well, so Steve, if you've
Yes.
got a family history of autoimmune diseases,
Right.
correct?
Yes.
Aren't you more prone to like
It depends on what they are.
Hashimoto's or PCOS or just PCOS come from a parent who's got diabetes because you're lucky?
Now you've just asked me a fucking question I don't know the answer to, so I'm going to
That's
look it up.
what I
Hang on.
always thought.
Okay. I'm just
I have
stopping
all
recording because
kinds
that's a
of
great
autoimmune issues.
risk factors for.
So the Mounjaro, I lost
Yeah.
in like 2 months.
Mm-hmm.
That's why these
For what are you asking,
Nice.
Tacey? Risk factors for autoimmune?
Yeah, if you have
Yeah.
is PCOS like a risk factor for an autoimmune disorder, or is it just like if you're more likely to get that because your parent was diabetic?
PCOS and autoimmune diseases share potential causes. Family genes. Hormonal inflammation.
Okay, here we go. Well, risk factors for autoimmune diseases include some medications, obviously having relatives with autoimmune diseases, smoking. People, if you already have one autoimmune disease, you're more likely to get another one. Being female, 78% of people who have autoimmune diseases are female, and being overweight. So I know. Yeah, I know. You guys get screwed on everything. All them periods and tits and stuff. So, anyway, but, So, and now as far as PCOS, let's look up risk factors for PCOS. and see if it's genetic. I would say that it almost has to be.
Yes.
But type 1 diabetes, type 2 diabetes, well, no kidding. Gestational diabetes, insulin resistance, yeah, well, okay. These aren't really risk factors. Those are concomitant illnesses. But, yeah, pretty much, okay, let's look here under Mayo Clinic. This is the place I like to go. Symptoms and causes under Mayo Clinic. And, yeah, they're completely unrevealing. So, as far as risk factors are concerned, is it a cause that people with PCOS are overweight, or is it an effect? And
I always thought it was hereditary from a parent who's diabetic. That's what I always thought.
Yeah.
There is gene sequencing and an association between autoimmune diseases such as lupus, Hashimoto.
Really?
I mean, I'm just reading an article.
That's
really
okay.
quick,
That's all I'm
so-
doing because she just stumped me on this one.
Um,
You stumped the chump.
Stumped the chump.
Oh, well.
Basically, there needs to be more research because there's fluctuating levels of autoantibodies in different PCOS patients.
That's interesting.
Because I was thin when I was diagnosed with PCOS. I got off birth control because we were going to try to get pregnant. I gained 50 pounds in like 5 months.
Same. I can't take birth control, and that's when my weight went out the roof.
And that's when they figured out I had PCOS.
If it is autoimmune, if there's an autoimmune factor, there may be different treatment options.
Yep.
That could help with that.
Oh, interesting. All right. Well, to be determined in the
Be
future.
determined.
All right. Well, listen, everybody, thank you for being here. Thanks, Dr. Scott. Thanks, Tacey. Thanks, DNP Carissa. And thanks to everyone who's made this show happen over the years. Listen to our SiriusXM show on the Faction Talk channel. SiriusXM channel 103, Saturdays at 7 p.m. Eastern. Sunday at 6 p.m. Eastern, on demand, and other times at Jim McClure's pleasure. Many thanks to our listeners whose voicemail and topic ideas make this job very easy. Go to our website at drsteve.com for schedules, podcasts, and other crap. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, and get some exercise. We'll see you in 1 week for the next edition of Weird Medicine.
Goodbye,
Thanks, everybody.
everyone.
See you guys.
Bye.
All right, not done yet. Sorry. Carissa can't wait to get those headphones off. Hang on, we'll do this quick.
How can you tell?
What happened to the cat that ate a ball of yarn? They had mittens. And if you're heading out, you need to know whether you need mittens or sunglasses. Just ask. What's the weather? What do you get when you cross a broken ice cream truck with impressionist art? Van Gogh. Your dad is so eloquent, he can answer any question in just 2 words. Uh-huh.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by 2 really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic echographic and a pulsating shave. I want a magic pill for all my ailments, the health equivalent to Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve!
From the world famous Cardiff Electric Network Studios, it's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, now a podcast. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medicine provider who gives me street cred with the wacko alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And my partner in all things, Tacey. Hello, Tacey.
Hello.
And back from a prolonged sabbatical, it's DNP Carissa, everybody. Hello.
Hello.
This is a show for people who had never listened to a medical show on the radio or the internet. If you have a question you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call at 347-766-4323. That's 347-POOHEAD. Follow us on Twitter at Weird Medicine or at DrScottWM. Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy. Most importantly, we are not your medical providers. Take everything here with a grain of salt. Don't act on anything you hear on the show without talking over with your healthcare provider. Thank you very much. Please don't forget stuff.drsteve.com, stuff.drsteve.com. That keeps things going here. And just click on there. You can click straight through to Amazon, or you can click down and buy the Womanizer. That's everyone's favorite toy for fun Saturday
Everyone
night.
should buy one of those.
And then ed.drsteve.com. If you're a male and you're tired of taking sildenafil and tadalafil for erectile issues, the Phoenix may be a device for you. It's something to consider. It uses acoustic shockwave therapy, which is done in med spas all over the country and costs thousands of dollars. You can get a unit for a fraction of that. Well, it's a substantial fraction of that, but still a fraction of that, or $29 a month. You get a discount if you go to ED, like erectile dysfunction, echodelta.drsteve.com. And I'm doing a trial of one now, and I'll report back on those results. SimplyHerbals.net is Dr. Scott's website, SimplyHerbals.net. And then Tacey and I do a show on Patreon. It's patreon.com/weirdmedicine. We're kind of overdue, but I did a live stream the other night about the erythritol thing. It was sort of a pilot. It was terrible, but it's content, I guess, and we'll do better. But there's a lot of cool stuff on there. We've got Pete Davidson. We've got the Troika of Opie and Anthony, all three of those boys, plus Mark Normand and Joey DeRosa and some other folks like that on there. Jim Norton did one. So check that out at patreon.com/weirdmedicine. And if you want me to say fluid to your mama, I will be happy to do so, plus many, many other things. There's very few lines that I won't cross by going to cameo.com/weirdmedicine. And those are cheap. They're dirt cheap. It's like $9 or something like that. I just do it for the fun of it as I'm driving around. We've got one to do tonight as soon as the show is over, by the way. So the four of us will be doing a cameo for somebody. All right. Thank you. All right. There you go. Let's do this cameo real quick.
Okay. Do we need our...
You don't. No.
Oh, good.
All right.
You want me to leave this on for you?
Yeah, if you would. Okay, it's Captain Phil Gazer. Ooh, he's very handsome, a magnificent best friend, essentially a brother. Having a whole birthday weekend, dinner at Kobe's, cake and presents at his place the next day, and a baseball game. Oh, ooh, Star Trek trivia. Look up some Star Trek trivia.
No, don't.
Yes.
No. Who was...
And you can yell it out.
What was Star Trek?
All right. What was Star Trek?
What was Star Trek?
Star Trek.
What is Star Trek?
What is Star Trek?
Have we forgotten about Star Trek?
Picard?
Did we watch it last
Oh,
week?
shit. No, we forgot.
Well,
he's getting his PhD, and he calls from Tampa. Okay, well, we're going to be near there, but we're not going to be having drinks with Donnie. But okay, you ready?
Oh, yeah. Let's do it.
Oh, do you have Star Trek sound effects?
Oh, shit.
Yeah, I do.
Oh, God.
Okay.
Oh, God.
Wait, but
Oh,
let me
Carissa,
get a couple.
don't you have Star Wars?
I have Star Wars.
Yeah,
not
do
Star
that.
Trek,
No, that
though.
drives Trekkies crazy when people get... We'll pretend like we don't know the difference. All right, you ready?
I don't know the difference. Fuck Star Trek.
I'm with you.
Okay, here we go. Well, Scott says fuck all of it. He doesn't like any of it.
Well, fuck you.
I know, he's an asshole. Okay, here we go. Hey, it's Captain Phil Gazer. This is from Donnie. Your birthday's coming up. Oh, matter of fact, wait a minute. Let me look at my watch. Oh, it's in 3 days from when we're doing this. You're having a whole birthday weekend with dinner at Kobe's and cake and presents at your place the next day, and then a baseball game. Oh, girls, this might be something. He's into Star Trek trivia.
Ooh!
Oh, no, I was hoping for a ugh. I understand. Oh, it says you're very handsome with a youthful look. I'm very impressed with that. We like that. A magnificent best friend, getting a PhD soon, and actually calls in from Tampa.
Big bonus too.
Which is where we're going to be. We're going to be in Tampa soon, but we will not be having drinks with Donnie. So there you go. But anyway, yes. Okay, so you guys. Oh no, it's this.
I have a couple of questions.
It's Dr. Scott's trying to do live long and prosper, and he's doing a peace sign. Okay, so you have some trivia for him, Tacey?
Yes, in Gene Roddenberry's original treatment for Star Trek, what was the name of the starship?
Oh, what was the name of the starship in the original pilot?
The Yorktown.
The Yorktown?
Yes.
Bet you didn't know that. God dang. Oh, I mean, god dang you. All right. Anybody else got one?
I got another one.
Okay.
What is Sulu's primary position on the USS Enterprise?
Oh, it depends on
Ass Munch.
What year, but yeah, go ahead.
Ass Munch. Helmsman.
He was the helmsman.
That was close.
Surely to God you knew that.
Hey, man, happy birthday. Hope this wasn't a surprise because Dr. Steve gave it all away.
Yeah. He,
Hey,
Dr. Scott.
Hey.
Yeah.
Which Star Trek captain has an artificial heart? This is an easy one.
Oh, I don't know that. Christopher Pike?
Yes, you do.
Oh.
Jean-Luc Picard.
Oh, I didn't know that.
Woo!
Well, Jean-Luc Picard is completely artificial now.
That's right.
Yeah. So he has artificial everything. All right. Well, anyway. All right. Happy birthday. Goodbye.
Happy birthday.
Happy birthday.
Carissa could not give less of a shit. All right.
I only like Star Wars.
Happy birthday. Oh, why is it sound like that?
Oh, please tell me we don't have to do it again.
Oh, my
Please
God.
tell me not again. Please.
If you do it again, I'm answering everything with a Star Wars character.
No, I don't know why it's doing that. I had this problem the other day. I'm uploading it. I'll tell them I'll redo it if they don't like it. There's something wrong with the Cameo app.
Oh.
Okay. All right. We're going to play some music.
Hold
Carissa,
on.
you going to hang? Okay, you two are going downstairs. Okay, the girls are leaving us.
Unless you want
They're
to
gonna
listen
be-
to their music.
No,
No, that's
bonding.
okay. I'd rather drink wine with you.
Yeah, believe me, that's much more fun.
They're going to be bonding.
Cool, man.
The bonding tit to tit.
Tit-a-tit.
Oh, it's tit to tit. Okay,
Tit-a-tit.
sorry.
I think that's the highfalutin way to say it, Dr. Steve.
Oh. All right. All right. Okay, I'm going to put less reverb on your voice this time. Just as much on the mandolin.
Yeah.
Less on your voice. Okay, you gonna bring the microphone over?
Yep. I am ready. Come here, baby. Who was it? Well, here comes your curveball. Who asked for this? Rainbow Connection, Amanda. I can do Rainbow Connection and make it sound really good.
Oh yeah.
Just listen to
Because
my
Scott
Melissa.
likes to Kermit his voice up.
Chris R wants some Skinnered, man.
Okay. There's a guitar store that says "Do not play Stairway to Heaven," and then there's a bar in our town that says "Don't request Freebird."
Well, now they call me the breeze. I keep blowing down that road. A, D, now that they call me the breeze. D, D, I ain't rolling down that road. E, I ain't got me nobody. I don't care me no load. There you go. A little Leonard Skinner.
Okay,
let's do it.
All right, we can do it.
It's A.
Does it ever do anything different?
Let me look down through yours first. I've never even looked this. It's A-D-E the whole way.
Really? Okay.
Yep. Do you remember the song at all?
No.
It's called The Breeze. Yeah, it's really straightforward. 4/4 A-D-E. Yeah.
All right.
I think that's pretty close to being in tune. I think. Close enough. So, I'm going to kick it off. I'm just going to play A couple times. Well, now they call me the breeze. I keep rolling down that road. D, now they call me the breeze. I keep rolling down that road. E, I ain't got me nobody. I don't care me no halo. Ain't no change in the weather. Ain't no changes in me. Ain't no change in the weather. Ain't no changes in me. I ain't hiding from nobody. Ain't nobody other than me. Well, I got a green light, baby. I gotta keep moving on. Got a green light, baby. I gotta keep moving on. Hey, I've been California, might go down to Georgia, I don't know. Well, I dig you Georgia peaches, makes me feel right at home. Well, now I dig you Georgia peaches, makes me feel right at home. But now I love me no one woman, I can't stay in Georgia too long. So now they call me the breeze, I ain't blowing down that road. Well, now they call me the breeze, I keep blowing down that road. I ain't got me nobody, I don't carry no load. Well, I got me nobody, I don't carry no load. Well, that was fun. There we go. Yeah, we can't play Freebird, but we can play we can certainly play that wasn't a bad song. That was kind of fun.
I was terrible.
I love it. That was fun. No, I was gonna do a well, there you go, Chris. Hopefully that wasn't too terrible.
It was terrible.
Yeah, no, it was actually awful.
It's a given.
But it was fun though.
You were fine.
It was fun though. No, I was gonna keep it simple. You're getting ready to go on vacation. I figured we'd do Crazy as a Loon, John Prine.
Okay.
We haven't done that in a while.
Have we not?
I don't think we've done it in a little while. It's actually in D.
Oh, yeah, okay. I know this. Yeah, we did it not too long ago, but that's okay. You want to do it in D instead of A? That's what you're saying?
It's the very first word back is an A, but the song actually when it begins starts in D. Yeah, so it's E, and then finish with an A. Back before I was a movie star, straight up on the farm, a picture of another man's wife tattooed on my arm, with a pack of Camel cigarettes on the sleeve of my t-shirt. I'm headed out to Hollywood just to have my feelings hurt. Yeah, the town'll make you crazy. Give it a little time. You'll be walking round in circles down on Hollywood and Vine. You'll be waiting on a phone call at the wrong end of a broom. Yes, town'll make you crazy, crazy as a loon. So I headed up to Nashville to become a country star. Every night you'd find me hanging out at every honky-tonkin' bar. Pretty soon I met a woman, pretty soon she done me wrong. And soon my life got sadder than an old country song. Yeah, this town'll make you crazy. Just give it a little time. You'll be walking round in circles, looking for a country rhyme. You'll be waiting on a phone call at the wrong end of a room. Yes, town'll make you crazy, crazy as a loon. Pick it there, Dr. Steve. My savvy, bought myself a business suit. I headed to New York City, where a man can make some loot. I got hired Monday morning, downsized that afternoon. Overcome with grief that evening, now I'm crazy as a loon. So I'm up here in the Northwoods, just staring at a lake, wondering exactly how much more of this old shit this country boy can take. I ain't fish to pass the time away beneath this blue Canadian moon. This world has made me crazy, crazy as a loon. This world will make you crazy, crazy as a loon. All right, boys and girls, ladies and gentlemen, that'll do it for the evening.
All right, thank you.
We do appreciate you.
Yep.
Yeah, we'll be back in, I guess, not this.
No, this Saturday we won't. There will be podcasts coming out because we've got a big backlog of
25th.
podcasts, so they'll all come out.
It'll be not this Saturday, not the next Saturday, but the Saturday after that. Right?
Oh, yeah.
Because you're going 2 Saturdays.
Oh, shit.
Amanda
We
Swan,
could do that
you are
Sunday.
correct. That does sound similar to the old Dukes of Hazzard song.
Well, she would know. She's right country.
Yes, she was.
For somebody as into electronic music as she is.
Oh, really?
Yeah.
Yeah, that makes me want to do the Dukes of Hazzard song next time.
We can.
Yeah, we'll have to
Do whatever
that.
you want.
Anything John Prine is good.
All right, everybody. Thanks.
Boys and girls, ladies and gentlemen, have a good couple weeks. We will be back.
Maybe we could do
Amanda.
Maybe we could do
take
Sunday
care.
when I get back.
Amanda
if you want
Swan, take care. Yeah, that'd be good. Dennis, thank you. Sean, Chris, you guys take care. We do appreciate y'all very,
Yep.
very, very much.
Amanda.
You guys are the best.
Yep.
We'll see you in about 2.5 weeks.
There's old Dennis done.
Much needed vacation. Oh yeah. Yeah, we'll do it when we get back. We need to record some song.
Okay.
We
Yeah.
haven't done anything.
Yeah. I'm in.